Afternoon. This is our daily 5 p.m. update on the steps Kentucky is taking to address the coronavirus. Helped again today by Virginia. I appreciate all your help. And we have James that's going to help us here with the slides. I want to start the way we always start, and that's reaffirming that we will get through this and we will get through it together. It's not easy and it's not going to be easy. And it's probably going to get tougher before it gets easier. But we are resilient people, and we can and we will do this together. You know, I've seen others out there in media talking about this being the challenge of our generation. I fully agree. We look back on our grandparents being called the greatest generation, coming together both abroad and at home in doing what it takes to overcoming an adversary. The one that we face is not like one that we have ever seen in our lifetime. Instead of bringing us physically closer, it pushes us further physically away. But we know the stakes, and we know that we are fighting for the most vulnerable among us, and we have already proven that we are willing to put the health and the lives of our fellow Kentuckians above our economic interests. As long as we can continue to pass this test of being a good neighbor, as long as we can continue to be the great Kentuckians that we are going to protect a lot of people based on the steps that we're taking. I want to start by saying thank you. Thank you to Kentuckians for your sacrifice, for everybody out there that follows the restrictions and guidance, to everybody who has internalized this and said it is my duty as a neighbor, as a Kentuckian, and as a patriotic American to do everything I can to defeat this coronavirus, even if that means that we're celebrating Grandma and Grandpa's birthday via Zoom or Facebook, knowing that we are missing precious moments in our lives, and we are. But this is that important, and we are committed to doing what it takes to defeat this virus. I want to thank, we talk a lot about businesses that aren't doing social distancing. Those that are, thank you. Those that are being proactive on all this, thank you. I know your employees appreciate you, and we appreciate you too. I want to thank everybody that's out there donating what we call PPE, the personal protection equipment, something that is in great shortage in this country and in this state. Everyone who has that extra, who is providing it, thank you and keep it up. The more that we have of this, the sooner in our future we will be able to do that type of testing that all of us want to see, where everybody could get a test, even if it's just because you're nervous. We're not there yet, and it may take us some time to get there, but I'm working every day to get us there. And every donation of that type of equipment, we're talking about masks that are called respirators. We're talking about what they call the gowns, which is the clothing. We're talking about gloves. We're talking about swabs. All of those are important and help get us where we need to be. I want to thank the local TV and news stations that are streaming these updates. Folks, if this is part of our daily lives now, dealing with the coronavirus, but also hopefully talking at 5 o'clock every day. Hopefully this brings a little bit of normalcy to your life. I know it does to mine. That when we are a people that must come together, but do so staying apart, all of the television stations that are carrying this help us to be together right now, and help us to all get information directly and not from sources that would scare us or sources that would give us inaccurate information. I want to thank all the churches who abided by the guidance and did not hold in-person services, but found ways to get their message out online or in creative ways, and all the churches that rang their bells at 10 a.m. today. I want to thank all the frontline workers, the first responders, and the healthcare workers that march into danger every day to protect everyone else. I want to thank all the teachers who are doing all they can to help their students, even if it's not in person. This is what Team Kentucky looks like. It's about coming together, it's about being creative, and it's about making sure we do everything we can to beat this coronavirus. This is our job. This is the challenge of this generation. We are going to rise to it, and we're going to have to encourage everyone else to do it along the way. Because the fact is, we still have folks out there that pretend that this isn't either true or that it doesn't apply to them. And every person that doesn't abide by the guidance, that holds a public meeting, undermines the sacrifice that everybody else is making. I know we have a Lewis County pastor that is refusing to close in-person services at their church. You can't do that. Our churches are wonderful institutions. They're an incredible part of my life. But bringing together some of the most vulnerable in a small room when we know that this virus has been passed around in churches means that you are harming your congregation, and it undermines the sacrifice of every other church that is doing the tough thing and canceling their in-person services. So to our houses of worship that are doing this remotely over the radio, finding creative ways, thank you so much. I know that it was a difficult solution, but I believe you are truly doing the right thing. We'll also want to mention that social distancing is now our norm, and it won't be forever. We all look forward to the day where we can come back together the way we were before, and don't we miss those days? Sometimes you don't realize how important that personal interaction is until you have to do it 6 feet away or even further. But to get back there, we are going to have to be aggressive, and we'll talk about some new steps tonight to make sure that our parents and our grandparents are there with us, that we have protected absolutely everybody through this. And we're going to have to be diligent and resilient. Diligent in making sure every day we reduce the contacts, and resilient knowing that we got to do this as long as it takes. I'm committed to beating the coronavirus on the very first try. But remember that social distancing is not social isolation. You got to take care of yourself, your mental, your physical, and your emotional health. Use all the technology that's out there that you have to connect to other people. And just because you're supposed to reduce your contacts doesn't mean you can't go for a run on your own, or you and your family can't get out for a walk. Make sure that you get those dogs out there and you tire them out. Remember that COVID-19 spreads very easily, and you don't want to be the person that thinks that they are exception. You want to be a person that lives the rule. And so what we'd love to do is show a few examples. I've been asking you all to fill up social media because let me say that on social media, there are those that would spread misinformation, but let's also remember that there are enemies of this country that will intentionally spread misinformation. And they will do it here in the Commonwealth. They know where Kentucky is. They will do it everywhere else. And so remember that there are folks on social media, when you see things sometimes, that are trying to undermine our plans, that want us to fail. But we are stronger than that, and one of the ways that we make sure that people don't see and believe that is that we fill social media up with our good behavior, with the modeling that we want other people to do. So we've been seeing this pop up all over Kentucky, and it's kids, especially kids, doing the chalk on the sidewalks. But I love this one, and we can't click in on it on this, but it's about being kind. It's about being a good neighbor. It's about kids getting what we have to do and then being fully committed to it. Let's do the next one. This is one where this mother and daughter are delivering Girl Scout cookies free of charge to our frontline healthcare workers. And it's pretty special. Let's look at the next one. Okay, I love this. First, I promised you a cat. I'd shown a bunch of dogs. But what I love about this one is looking at, I didn't see the top one, is looking at, we will get through this together. We are resilient. She gets it. We all get it. This is the type of example we need to lead. All right. So once again, I owed people a couple cats. All cats social distance from me. I think they're judging me, but that's okay. I can handle that. And then let's look at, here are just a couple of others that we went through. Can you go back a couple? Again, these are making masks, people coming together, making sure that they can do, even if it's a small thing, something to protect those healthcare workers that are out there on the front lines. And here, again, we have more kids that get it, that want to make sure that they can do what they can do to encourage social distancing and make sure that they protect the most vulnerable amongst us. Right. And of course, we all are trying to find ways to get our kids plenty of exercise. Remember, they are also suffering from anxiety. That our conversations with them are critically important, and their exercise is too. And of course, we appreciate our state troopers and all of our law enforcement out there that aren't just doing their regular job right now. They are showing the acts of kindness that we need all over Kentucky. We appreciate that. So I want to move from this, one more it looks like. I want to move from this to a couple of pieces of good news today, and then we'll move into steps we've taken and new steps we're going to announce tonight. First, I was asked a question, I believe it was yesterday, about Amish and Mennonite communities. And what's great is when you're asked those questions, you learn the great work that many people are doing. Jen Harris works for the Todd County Health Department. Jen has been working with the Amish and the Mennonite community, especially in that area, which is the largest area. She has effectively communicated the type of restrictions and social distancing that is needed, and what we have seen is a big buy-in, at least from her, with that community. She is willing to work with those communities across the state. We are willing to share her information with anyone that needs it, but Jen Harris, we appreciate you. She did this as a leader, all on her own, just seeing the challenge we face and doing the right thing. Another good piece of news is we have at least 2 new labs that are now getting up and adding on to our capacity. One is the University of Kentucky, and one is called Diatherix. And the third piece of good news, and you're going to think it's strange that I say it's good news, is I think I gave you a wrong statistic the other day. I think when I compared unemployment applications to this time last year, I told you they were 8 times. They are 30 times. And why do I think that's good news? Because we have to make sure that everybody has enough to get through this. There is no stigma on public assistance. James, if you'd show the unemployment slide on how people sign up this week, we want to make sure that everybody who needs help getting through this gets through it. And because there are so many applications, which we want to continue to see, we have a schedule signed up this week. Make sure you follow it. You won't be penalized for following the schedule just because your day is a little bit later. We just want to make sure that you can get your benefits with the least amount of hassle that is possible. Remember, Medicaid is also available. SNAP is also available. We want to make sure that everybody gets the help they need coming through this. If we go back to the hashtags, I just want to mention again that we are encouraging people, whether it is the good things that are out there, filling up good news, to use these 3 hashtags, Team Kentucky, Together KY, and hashtag Patriot, but we are also asking people to use our new one, which is Healthy at Home. Remember, the healthiest place that you can be right now for you and in the fight against the coronavirus is at home. That doesn't mean you can't go for walks. It doesn't mean you don't go to the grocery store. It just means that you do your part by limiting your contacts as much as possible. All right, so for tonight's update, we have now what we believe are 103 confirmed cases of the coronavirus here in Kentucky. These are more, obviously, than we had yesterday, but we expect this. This is the way that this virus works. Can we see the slide on Philadelphia versus St. Louis? Everybody talks about flattening the curve. We have lots of new terminology that we never knew just a couple of months ago. And this is one example compared to the Spanish flu. Again, as a reminder, the Spanish flu, we believe, was deadlier, and we did not have the same healthcare system that we do now in 1918 as we do in 2020. But what we are trying to do is make sure that we are more like St. Louis than Philadelphia, because it makes sure our healthcare system has the capacity to take care of the sick people that we're going to see. But remember in each of those that there is an escalating number of cases. We are going to see more cases every day. Let's be prepared. Let's be ready to be resilient, but let's also know all the steps we're taking and all the sacrifices we're making are to make sure that we can protect our people and that, again, we look more like St. Louis, because if that dotted line, say at 50, is our healthcare capacity, we want to make sure that we stay underneath that line. It's really important because at the end of the day, the number of people that get the coronavirus isn't going to be nearly as important as the number of people that get better after having the coronavirus. Now, we are going to do everything we can to control the number of people that get it, but what's really, really important is that those that get really sick through it, and most people won't, but those that do, there is the doctor, there is the resources, there is the nurse, there is everything they need. Now, the part that we can control about this, if we are diligent and good citizens, is to make sure that even if a large number of Kentuckians end up with the coronavirus, that the vast, vast, vast majority of them are okay and that we are there for them. So of the 103, I believe the new cases are in Fayette, Jefferson, and Jefferson. And then we have 1, 2, 3, 4 that we do not know about. Fayette, Christian County, 1 in northern Kentucky, 1 in Hardin, and 1 in Henderson. Again, this is one of those, our numbers are not as accurate as they were in the past because we have more labs that have come online. That's a very good thing. It means we have more capacity today than we did yesterday as far as tests go. But it also means it's harder to get the data in at our Department of Public Health than it was. Just a couple of other numbers. We now believe there have been well over 2,000 tests administered here in Kentucky. Of the tests that we truly know about, the average age of someone who's gotten the coronavirus is 53.3. And it looks like while the hospitalization rate is amongst those that have been tested and those that have significant symptoms is somewhat high. The ICU rate is down at about 6% right now. That is a testament to how well our hospitals are doing. That means that someone who is very sick that is in a hospital, our hospitals are doing an excellent job, and to all those systems, we appreciate you. Folks, this is why we've talked about elective surgeries. We got to have all this capacity to make sure everybody gets that type of care. The coronavirus hotline I want to mention real quick. Remember, this is our hotline dedicated to the coronavirus. It is 1-800-722-5725. As of yesterday, we had 22,841 calls to this line since setting it up. It's about 2,400 calls a day right now, but I do want to remind you of when you should call it. And all these steps, they're going to change over time, depending on where we are in this. You know, when we have these escalation of cases that are happening right now, we're going to need to conserve resources. Those that are well can't be using them. Those that are sick need to be using them. And that will change as eventually we move and at some point see fewer cases. So again, if you are healthy, but you're just nervous, remember we're all nervous. You don't need to call that hotline. You don't need to call a doctor. Just practice really good hygiene and make sure that you're looking out for everybody around you. Even if you are well, make sure you treat yourself in many ways like you have the virus, not from self-isolation, but by making sure that you practice good hygiene and that you engage in social distancing. If you are sick but would have not otherwise sought care, call the hotline. That's the right place to go at that time. And then if you are truly sick and or injured, make sure you go to a healthcare provider. That's the way we conserve our resources. That's the way we look out for one another. All right, steps that we have taken to address the coronavirus, and I'm going to only go through parts of these. We've declared a state of emergency that's going to be in effect until we get through this. We have our Emergency Management Operations Center up and our State Health Operations Center. We have our coronavirus hotline. I want to mention the website, kycovid19.ky.gov. In a world where misinformation is so easy to spread, the website is the critical place to go. That is kycovid19.ky.gov. There we go. Good job, James. We got it up. We issued an executive order to prohibit price gouging. That number to call is 888-432-9257. Let me mention again that every major grocery in America and in Kentucky, personally to me, has said there's going to be enough. You don't need to buy for a month, buy for a week at most. No matter what steps that we have to take in this administration, you're always going to be able to go to the grocery store. Make sure that you buy enough for your family, but there's enough for the next family coming behind you. These are not the times to hoard. These are not the times to react in fear. These are the times to understand that how we treat each other is what gets us through this. We've adjusted our sick leave policy in state government. Every business out there needs to do the same. Paid sick leave is the way you make sure an employee that is sick does not come back to work. The CDC guidelines, they're out there, they're changing, they're critically important. They tell you that everyone should be engaged in social distancing. And again, if you're over the age of 60 or you have heart, lung, or kidney disease, compromised immune system, diabetes, be extremely careful. At this point, for any Kentuckian, any American, don't fly if you don't have to. And whatever you do, don't get on a cruise ship. We've issued executive orders and have worked in Medicaid. We want to make sure that both the testing and the treatment for the coronavirus is free. We have limited visitation in just about every type of facility that works with or for our seniors. This is a group that we are fighting for against this virus. This is a group, our parents and our grandparents, who are highly susceptible to it. If you want to know why we are changing our lives so dramatically, just think about that loved one. And yes, it's really hard that we can't see them right now. But what we are doing is for their life and health and everyone else's life and health too. We've recommended our school cease in-class activities, and that, of course, has been extended. Every school district right now is complying. Every school district is providing NTI, non-traditional instruction, to those students they can reach. Remember, keep your kids on a schedule. Now's not the time to sleep in or stay up late when there's that anxiety out there. Make sure you're keeping them on a schedule where they have some scholastic activities, some schoolwork, where they have physical activities, and then spend as much time as you can with them too. We are making sure that our first responders and our healthcare workers are covered through our Kentucky Employers Mutual Insurance. We have asked Kentucky's hospitals to cease elective procedures. I'm going to talk about that here again in a minute. Child care centers are now closed, with the exception of those that are going to help our healthcare workers, our police, and our firefighters. It's a necessary step in making sure the coronavirus doesn't spread. While kids can get the coronavirus, we've seen that. They're incredibly resilient. What they can do is spread the coronavirus. So we got to make sure we reduce their contacts just like we have to reduce everybody else's. We have brought all the Kentuckians on the Grand Princess cruise ship back home. We are still proud about that. We had to close restaurants and bars to in-person traffic, except for drive-through, delivery, and in some instances, takeout. We've waived the waiting period for unemployment for folks, and we continue to work to reduce the barriers to unemployment. Independent contractors, small business owners, we're working on it. And let me mention that while the SBA has granted our application to allow people to get disaster loans, they have not updated their website, so right now Kentuckians can't apply. That's not acceptable. I've called the main number that we were given, to speak to either HHS or the Vice President's office. They listened to the call today. It sounds like they are on it. But no, we are working, and also know that the first call I made, it appears that we are getting a response. We're going to do everything we can to extend things like driver's license, because you shouldn't have to go in right now. We're also extending Medicaid and SNAP and all the benefits that people are on that are out there. If it's running out and you would have to reapply in the next couple months, you don't have to. We're already re-upping you for, I believe it's a 3-month period. It is a 3-month period to make sure those lines are open for everybody else who needs that help. We signed an executive order that, again, by this last Wednesday, all public-facing businesses that encourage public congregation were closed. Acute care facilities and others. We made changes on Medicaid to make sure that people could get signed up. We suspended our charitable licenses. And we issued a formal letter banning all mass gatherings. That is what we have to do. So, new steps that we are taking here today include first, as of tomorrow night at 8 p.m., that's Monday night, as of 8 p.m., we're going to close non-essential retail businesses. This is the next step that we need to take to reduce the contacts amongst Kentuckians until we can defeat this virus. Now, let me be real clear that the retail businesses being closed do not include grocery stores. They will stay open. Pharmacies will stay open. Drugstores will stay open. Gas stations will stay open. There is no need to rush to those types of stores. And please, don't rush to any of these types of stores. What that does is create a crowd that can spread the coronavirus. What the non-essential retail businesses that will need to be closed to in-person traffic tomorrow night by 8 p.m. do include entertainment, sporting goods, clothing, shoes, jewelry, bookstores, florists, furnitures, and auto dealers, though auto repairs and parts are going to be exempt so people can get what they need. So this is another step we're having to take, and another significant step. And I know a lot of people, just like restaurants, bars, and other public-facing businesses, these are your dreams. I understand that, and I hope you know that I feel that and get that in making this order. But it's going to take this type of sacrifice and continuing to take more steps each day or every other day to do what we need to do. So again, we're going to be closing non-essential retail businesses effective 8 p.m. tomorrow night. But folks, that does not include groceries or pharmacies or drugstores. There is going to be enough of all of the essentials for everybody. Second piece is we had previously recommended that our medical facilities cease elective procedures. Starting tomorrow, we're going to have to mandate it. Now, vast majority of providers have done it voluntarily and are truly making plans, are absolutely on Team Kentucky. But whether it's a group of chiropractors that have been exceedingly difficult, or others that think that they should be the exception, it is now requiring us to turn it into a mandate. It's unfortunate that when the actions of so many all comply with where we need to be, the actions of a few can cause us to get more restrictive. Folks, we're going to continue to have to take these types of steps. But understand, no matter what steps that we have to take, you're still going to be able to get the essentials that you need. You're still going to be able to go out for a walk and get exercise. You're still going to be able to live your life in a way to where we can and we will get through it. We just have to continue to reduce the contacts that are out there. All right, we're going to take about 15 minutes of questions if we have that many today. And then since I've been going long on the last couple weeks, we'll try to wrap up a little early. So we'll take some from those that are here live, and then I've got some that are written. I'll start with the written ones. It's a concerned citizen asking about busing. I believe this is busing in Louisville, that it's still transporting people. While we are looking at all areas, getting our healthcare workers especially to the places they need to go, sometimes getting individuals that couldn't make it to their grocery store where they need to go is still critical. I know that the group that the question is about is looking at their policies, but this is one where we have to make sure that those where we need to get places can still get places. The second one is there any concern about the transmission of the coronavirus through the touching of gas pumps? Should we expect any forthcoming restrictions on gas stations? Gas stations need to stay open, but yes, this virus can live on just about any surface for a while. So use your hand sanitizer, bring it in your car, and or wash your hands after you use a gas pump. This is one of those areas where this virus spreads easily, and it's everywhere. Just because we haven't reported a county that doesn't have it, the coronavirus is there. So part of our daily lives are going to have to be the hygiene about when we touch things that are anywhere in public, and making sure that we've done what we need to do to protect ourselves and to not spread the virus. Where do I stand on the need for a shelter-in-place order in Kentucky? Has it been discussed? So this term shelter-in-place, again, I don't think is descriptive, even though other people are using it. Shelter-in-place evokes emotions in us that are a deadly chemical spill near our house, or even an active shooter. It says get in your house and board it up until we call you. That's not the way that we will address this coronavirus. Our way is healthy at home. That any type of steps, initiatives, restrictions that we put into place will always allow you to be healthy at home. That doesn't mean board it in your home. It means you'd still, no matter where we go, be able to get your essentials out in the community. And it also means that you would be able to get out and get the type of exercise that you need. And so, what we're doing tonight on retail is the next step of our Healthy at Home initiative. You are the most healthy right now at your home or around your home. And again, that's just about bringing your contacts in as small as we can of actually one-on-one interaction. What plans are being made to utilize empty motel rooms for either patients or people where it would be needed? We're working on those right now. We're working on a number of locations if they're needed. I do want to thank that community, that hospitality industry, for stepping up and for making offers. We are going through all of that planning right now. I am confident that there is, I do have confidence in the food chain supply, which is the next question. There is going to be enough. In fact, it's just we are our own worst enemy in that. The issue isn't that there isn't enough in stores, it's that we take too much when we go to the stores. Remember, your actions have consequences on other people. Let's just be a good neighbor. There's a question here about restrictions for truck drivers at truck stops. We have not gotten this question before. It's something we'll have to look at. Our truck drivers are really important in moving equipment and necessary supplies during this coronavirus, and so we'll have to make sure there is still the ability to do that. Anybody in here? Yes, sir.
In your mind, what's the difference between a shelter-in-place order and your healthy-at-home initiative?
It's, in my mind, what is the difference between a shelter-in-place order and the Healthy-at-Home initiative? So we've seen states take very different approaches. There was a state that just put out one of these a couple days ago, and when I looked at it, it had a lot of things that we've already done. For the first time, it closed bars and restaurants and public-facing businesses and stopped the non-essential, the elective procedures. We have already done a whole lot of what other states are doing in kind of one major, and sometimes it seems scary, order. We've been doing this as Kentuckians. We've been stepping through it. We've been aggressive, but we've been taking one step, and then we've been taking another step and another step. And I think that's how we get to where we need to be. And it lets us all work into this new, I don't want to say normal, because it's not going to be forever. And the more we do, hopefully we can shorten the time that we're going through all of this. I got a couple questions here. What does the governor think of Rand Paul testing positive for the coronavirus? I wish him the best and his family the best. I would just want to make sure that with him having to self-isolate, hopefully they are staying in communication, and we hope that he and everybody else gets through this in the best place possible. I believe right now there's no Democrat, there's no Republican, they're just Americans versus the coronavirus. And even with his vote, that seem to place limitations on getting this aid, we still want him to be healthy. I mean, he's a human being, and we're all in this together. Yes, ma'am.
For the restriction on non-essential retail businesses, are they still able to do things like curbside service, like some of the restaurants and bars are now picking up?
That's a good question. Thank you. It is for the non-essential retail. Can they still do curbside and pick up? The answer is yes. While they can't come into the store to get something, they can order on the phone, online. There can be that curbside pickup. There can also be delivery. So any of these stores that are deemed non-essential, and we'll have that guidance out, it's part of our executive order, can absolutely deliver. And especially for our local businesses, let's band together like we've done our best we can with takeout, and let's do everything we can to help them and their employees get through it.
What steps are you taking to make sure that the state has enough protective gear for nurses and doctors in the hospitals?
So what steps are we taking to make sure there's enough PPE, protective gear for nurses and doctors? We are doing everything we can. We are chasing down every lead. We are pressuring every person. We are making every phone call. It is a problem that there is not enough PPE in this country or in this state. And it does mean what our healthcare workers are doing is that much more special. Now, I'm going to work like heck, and I'm working like heck to make sure every day that we have as much as humanly possible. And we've got some positive potential news that's out there. But again, when I talk about hope, I'm going to make sure that it is fully real and that we are going to level with the people of Kentucky. This is one of our biggest limiting factors about when we can set up that mass testing that everybody wants. If tomorrow we could get millions upon millions of masks and gloves and swabs and the rest, we'd be really close to doing that type of testing. But this is the thing that everyone in the country is facing. And while we don't have it at the moment, the amounts we need, it means what we have is really important. And it means what we have needs to be used on those that are in the worst shape and that need our help the most. Yes?
Are liquor stores included in the non-essential? I think it's different in some states. I didn't know.
Are what type of stores?
Liquor stores.
Liquor stores are excluded from the shutdown. They will still be open.
Hardware stores, banks, veterinarians, are they included in non-essential?
Banks and these are retail stores. So banks are not retail, veterinarians are not retail, and I'll have to get you an answer on hardware. There are stores that on the breakdown that we believe are essential, certainly to home repairs, and we want to make sure that those stay open. I want to close today, and I'll answer one of these other questions that I'm glad today that we didn't add to our death tally, and I hope that won't be something that we have to mention every day. It was hard yesterday announcing that one. We lit up the Mansion Green yesterday, and any other day that we have to make that announcement, we will too. It is a color that is associated with compassion and renewal. And why we're doing this is to protect everyone out there, so hopefully we don't have to make those announcements too often. Now, I got about 4 questions on these, and I'm just going to answer one. And it's, have you seen the meme fan page on Facebook with over 40,000 followers? If it makes people smile right now, I'm for it. We're living in different times, certainly, if that's out there. I'm just glad that we can come together every day at 5 to make sure that we stay calm, because we're facing something that none of us have ever seen, and that you get information directly from me. I know we're going to make it through this. I know we are. And I know it's going to be worth it in the end. I know all of you all are making sacrifices, and if a meme helps to get a laugh at a time that we need more laughs, go for it. I did get a really nice email from a woman making socks, and it was nice that she asked. But if it made her smile and it makes anybody else smile, then good. But I want you all to know that I know that my job right now, while I enjoy those, is really serious. It's about making sure that I do everything I can for all of us out there and for all of our families. And every day I'm doing the best I can, as is our Department of Public Health, as is our Cabinet for Health and Family Services, and everybody else. I hope one day that we could look back on this and say we were really aggressive. And in fact, I hope one day maybe they'll look back and say we were more aggressive than we had to be. That's because we care. That's because I want to make sure we take every step to protect those around us. And as we see more positive cases, and we will, that you have the confidence that we are taking the steps to protect the people that you love. We're going to get there. And we're going to get there by being the really good people that we are. So again, be that model. Fill up social media. Use those hashtags. Be the model of exactly what we need for our people right now. And don't be the exception. Whether it's a business or a medical practice or one pastor that doesn't heed everybody else's sacrifice and brings a bunch of people together that could be the most vulnerable. We have to be better than that. And as we move forward, we got to be strong. We got to be resilient. We got to know that we face something significant, but we got to know that every other generation in this country that has ever been faced with a major challenge has beaten it. And we will do the same. We will pass this test. We will make it. And I look forward to that day where we can all be back within 6 feet of each other. Thank you all very much.